So what I really need to do is I need to start into my next lecture in my viral series, which is the influenza virus. But I'm getting a lot of questions, so I'm going to try to answer the questions as best as I can. Okay, question number 1. Why the Moses social distance of 2 meters? Well, that's a really good question. We know that the influenza virus, remember, we're talking about influenza, not coronavirus. We know that the influenza virus is aerosol, spreads when you cough, spreads when you sneeze, and spreads when you're breathing. We know that the influenza virus, when it does spread from coughing or breathing, usually spreads about a meter, maybe 3 feet, 4 feet, if a cough has large droplets. The whole droplet conversation is an entire video or 2 or 3 in and of itself, and I might get into that, but right now all I want to teach you is that the Moses social distance of 12 feet is because I know that I've seen patients coughing, sneezing, and in my experience, I do my best not to get sick. I go in, if the patient is here and they're facing that way, I listen to their lungs, I listen to their heart, I stay to the side of the patient, try to make sure their head is facing away from me, and then as soon as I finish my clinical exam, I step away from the patient as much as I can and then continue talking to the patient, or if it's a child, talking to their parent, but I'm keeping a good distance from them. And by doing so, I've been fairly successful at not getting the flu in many years. My Moses social distance of 12 feet or 15 feet is because, in my opinion, if you can stay 6 feet or less away from somebody who has influenza and not get influenza, then with this year's coronavirus, which I think is a lot more infectious than influenza, and we've heard the reports say that it's at least 3 times more infectious than influenza, I think that you should double that distance from 2 meters to 4 meters, 12 feet to 15 feet. As opposed to just 6 feet, which is the distance from this hand to that hand. Actually, a little bit more than 6 feet for me, but this is 6 feet, and I don't think that's enough. And I know that this virus is very infectious, so again, the Moses social distance is 12 feet. I believe that if you can stay away from people who might be sick, and you can keep 12 feet of distance between you and the other guy or the other woman, whoever that is, I think that that will keep you relatively safe from getting this illness. I think that 6 feet is a little bit too close because in my experience with influenza, not coronavirus, if I keep myself at least 6 to 10 or 12 feet away from somebody, or as far as I can inside those little tiny hospital exam rooms, I usually don't get sick. So if I'm not getting sick and I'm only 6 feet away, if you stay 12 feet away, you shouldn't get sick. So consider that Moses social distance of 12 feet, and there's your reason for why I think you should do that.